Understanding fibroids. Breaking the silence. Welcome to Oil of Myrrh series. We are a women's health awareness series for single and married. Today we will be talking about understanding fibroids. In this video, we will be looking at what are fibroids? Types of fibroids. Who is at risk? How are fibroids diagnosed? Treatment options. Fibroids and fertility. Myths and facts. Lifestyle and prevention. A call to action. What are fibroids? Fibroids are non-cancerous, benign tumors that grow in or around the uterus. They are made of muscle and fibrous tissue and can vary in size. Some women may have one fibroid, while others may have many. Though not life-threatening, fibroids can significantly affect a woman's quality of life. Types of fibroids. Intramural, grows within the muscular wall of the uterus, most common. Subserosal, projects outside the uterus into the pelvic cavity. Submucosal, grows into the inner lining of the uterus, more likely to cause heavy bleeding and fertility issues. Pedunculated, grows on a stalk either inside or outside the uterus. Symptoms of fibroids. Heavy or prolonged menstrual bleeding. Pelvic pain or pressure. Frequent urination or difficulty emptying the bladder. Pain during sex. Lower back pain or leg aches. Constipation. In some cases, difficulty conceiving or recurrent miscarriages. Some women experience no symptoms at all, asymptomatic. The 13 risk factors for fibroids. 1. Women in reproductive years, ages 25 to 50. 2. Women of African descent. African or African American women are at higher risk and often develop fibroids at a younger age. 3. Genetic predisposition. Family history, higher risk. 4. Diet, high fat, red meat, dairy products and low in vegetables. 5. Women who have never given birth nulliparity. 6. Unhealthy lifestyle. Alcohol drinking, smoking, obesity, or being overweight. 7. Sedentary lifestyle, lack of physical activity. Note that stress is not exercise. 8. Women who started periods early in life. 9. Exposure to environmental toxins and pollution. 10. Vitamin D deficiency. 11. Not eating enough fruits. 12. Chemicals from hair products, relaxers, hair dyes, and skincare products, phthalates, plastic food containers. 13. Emotional turmoil, toxic relationships, heartbreak, unforgiveness, exposure to childhood abuse. How are fibroids diagnosed? Pelvic examination, a routine check that can detect an enlarged uterus. Ultrasound scan, the most common imaging tool to see fibroids. MRI, offers detailed images to determine size and location. Hysteroscopy or laparoscopy, minor procedures to view fibroids directly, especially when surgery is being considered. Treatment options. Treatment is to be determined by medical advice from your doctor. However, some available options are watchful waiting, if fibroids are small and not causing symptoms. Medications, hormonal treatments, e.g., GnRH agonists, pain relievers, birth control pills. Non-invasive treatments, MRI-guided focused ultrasound. Minimally invasive procedures. Uterine fibroid embolization, UFE. Myomectomy, removal of fibroids, preserving the uterus. Surgery, hysterectomy, removal of the uterus, often last resort. Fibroids and fertility. Not all fibroids cause infertility. Submucosal fibroids are most likely to interfere with conception or pregnancy. Fibroids may cause miscarriage or complications during pregnancy. Treatment can improve fertility in some women. Always consult a gynecologist for tailored advice. Myth versus fact. Myth. Only older women get fibroids. Fact is women as young as 20 or younger can develop them. Myth. Fibroids are always cancerous. Fact is fibroids are benign and not linked to cancer. Myth. Hysterectomy is the only treatment. Fact is many women can manage fibroids with less invasive methods. Myth. You can't get pregnant with fibroids. Fact is, many women with fibroids have healthy pregnancies. Lifestyle and prevention. Eat a balanced diet, high in vegetables, fruits, fiber, and low in red meat. Maintain a healthy weight and exercise regularly. Manage stress and avoid excessive alcohol or caffeine. Go for routine gynecological checkups, especially if symptoms appear. Healthy habits can help reduce the risk and improve quality of life. A call to action. Don't ignore heavy periods or unexplained pelvic pain. Speak to a healthcare provider if you notice symptoms. Share this information to educate other women. Support someone with fibroids. Listen without judgment. Use your voice on social media during the Fibroid Awareness Month.
A woman is empowered through education about her body and how it works. Knowledge is strength. Join us at Oil of Myrrh, a women's health awareness series. For matured single ladies and married women also, her beauty and well-being.